guys to a new YouTube video. Today we are doing an episode about menses and pregnancy. So today's episode, I hope you learn a lot. We are going to do about menses and pregnancy. So when you visit a healthcare facility, when you attend your antenatal clinic, that is the NC clinic, there are some part of history, there are some part of questions that the healthcare provider may ask you, why about your menses, about when they started, about the duration, about whether they are heavy or light menses. So this part of history is always very important, especially during your first NC visit. So some of you may think that maybe this healthcare provider is intruding into my privacy, is asking me a lot of questions. What is he or she is intending to achieve with this kind of history? No, it's good to ask this kind of questions, so that it forms the basis of your care throughout the pregnancy period. So just bear with the questions that the healthcare provider asks you, because they form a major part of care during your pregnancy period. So I want to talk about some important things. I want to talk about something called parity. I want to talk about something called gravidity. I want to talk about something called LMP. To start with, let me start with LMP. So LMP basically it means that the last menstrual period. So what does it mean? The last menstrual period? So let's say that today is 13th of October. I'm shooting this video on 13th of October. So let's say that if this is the first day of your period, you are not pregnant yet, but this is the first day of your period, the 13th of October. So your period has started today, the 13th. And let's say maybe in the course of the month, maybe you are planning to be pregnant, or you plan, or maybe it comes by chance, because some of them happen by chance, not planned ones. So let's say your pregnancy happens, you happens to conceive maybe let's say at the end of this month. So today marks the first day of your period. So if you conceive this month, or before you attain your next period, let's say maybe this month or early next month, before your next period, so this will mark your LMP, the last menstrual period. So it's basically the first day of your last menstrual period, not exactly the last day of your last menstrual period before you conceive. So this day is a very, very important day, very, very important day. And if any case you are in a if you can manage to maybe to write it down, or maybe to note it somewhere, maybe in your calendar or maybe in your phone, it could be better for you, because it's very, very important day as far as your pregnancy journey will be concerned. Why am I saying so? Because one, LMP, which is the first day of your last menstrual period, the first day, not the last day. Why is it important? One, because throughout the pregnancy, first it helps us to identify something we called expected date of delivery, what we call EDD, expected date of delivery. So we can use your last menstrual period, which is LMP, the first day of your last menstrual period, to calculate your expected date of delivery. Are you guys seeing how important it is? Yes, it's very, very important. If you can note it somewhere, if you can maybe highlight it somewhere in your phone or your calendar, it will be a very good decision. So let's say for example, today 13th of October becomes your first day of your menses, and you happen to conceive at the end of this month, or maybe early next month, before the next period. So today will be your LMP. So if you visit a healthcare facility for maybe your health for your pregnancy test, maybe for your NC visit, your healthcare provider will ask you, when was your last period. What he or she basically wants to know is the first day of your last menstrual period, which is LMP. So let's say, for example, this is today is 13th, and your period started today, and you happen to conceive at the end of this month. The healthcare provider will be able to calculate the expected date of delivery, what we call EDD. So how does this happen? Let's take 13th of this month. So what the healthcare provider will do is basically, we have 7 days in a week, right? 7 days in a week. And then we expect pregnancy, a normal pregnancy duration to be 9 months, right? So having 7 days in a week, and we expect pregnancy to be 9 months, the normal duration of a normal pregnancy. It can be shorter if maybe you have complication or you miscarry. It can happen, but the normal duration of pregnancy we expect to be from first month to the 9th month. So your LMP is 13th of October. How do you calculate your expected date of delivery? You add 7 to the date, because we have 7 days in a week, right? So we have 13th, of this month. We add 7, we get 20th, right? Then, because we expect pregnancy to last for 9 months, what are we going to do? Because we are in October, we're going to add 9. Then we have a total of 19 months. But basically, because the whole year, our year is made up of 12 months. We subtract 12, get 19 less 12, we get 7 months. So what is your expected date of delivery? It is 20th of July 2025, right? So because you have 7 days in a week, we add 7 to the date of your last menstrual period. So which is 13 plus 7, that is 20th. Then we add the month we are currently in, plus the number of months, the duration of pregnancy, which is 9 months. 19 less 12, we get 7. So your expected date of delivery is 12th of July 2025. But this may not be the case, right? So at what we expect, the expected date of delivery may be plus or minus 2 weeks. It may be, we say that you are expected to deliver by 20th of July 2025, right? Either by 2 weeks or come 2 weeks earlier. So it's either plus or minus 2 weeks from the expected date of delivery. So that's one reason why I'm saying that LMP, the first day of your last menstrual period before you conceive, is very, very important. You can note it somewhere. So it helps us to determine the expected date of delivery. Another thing which we can determine from the LMP is maturity by date, what we call MBD, maturity by date. What does this mean basically? So let's say that 13th is your LMP, as you have said. For example, yours may be maybe in 14th, 15th, or any other day, but I'm using 13th just as a reference. So let's say your LMP is this 13th. So how can we calculate your maturity by date? So you decide, let's say for example you decide to visit a healthcare facility, maybe let's say 5th of January, and you conceived maybe the end of this month, and your LMP is 13th of this month. So how will you get your maturity by date? So maturity by date basically means when you come to a healthcare facility, your healthcare provider will able to determine the number of weeks your pregnancy has attained, as far as the time you've visited the healthcare facility is concerned, right? So let's just pick a date. Let's say 5th of January, maybe next year, 2025, and you conceived this month, right? So how can we know the number of weeks your pregnancy has attained as of 5th of January? So what the healthcare provider will do, or what you yourself, you can even do it by yourself. What you do, we are in 13th. Let's say 13th is your LMP, right? So October has 31 days, right? So 31 days less 13, we get 18 days, right? If I'm not wrong. So 18 days, we have to include this day, the first day of last menstrual period. We have to include it. So we have 31 days in October less 13, we get 18, right? Plus 1, which is today, we get 19 days remaining till the end of this month. We include the day of LMP. So we have 19 days in October remaining. In November we have 30 days, and in December we have 31 days. And you decide to come. You decided to come to healthcare facility on 5th of January, right? 2025. So we have 19 days remaining in October. We have 30 days in November, right? We have 31 days in December. And because you decided to visit a healthcare facility in 5th of January, you have 5 days in January, right? So your maturity by date as of 5th of January will add the number of days. 19 days in October, 30 days in November, 31 days in December, and 5 days in January, right? So if you add all of them, it totals to I think 85 days, right? So we have 85 days as of 5th of January. That's the day you visited the healthcare facility. You want to know how many weeks as I attained as far as my pregnancy is concerned. So we have 85 days as of 5th of January, right? So we divide it by 7 to get the number of weeks. So if 85 divided by 7, basically it will be 12 weeks, 1 day, if I'm not wrong. So as of 5th of January, your maturity by date will be 12 weeks, 1 day. So that's how you calculate maturity by date from LMP. Are you seeing how LMP is very important? It is very, very important. If you can note it somewhere, if you are planning to be pregnant, if you plan maybe in 2 months' time you will be pregnant, you have to note your LMP. It saves you a lot and it helps you monitor the progress of your labor, right? So one, we say that it helps you to know the expected date of delivery, which is EDD. Second is it helps you to know how to calculate your maturity by date. You can just choose any date. Maybe you decide to visit on 10th of January or 20th of February. Just calculate as I've told you about it. So that's one LMP. Very, very important. The healthcare provider will want to know when was your last menstrual period, the first day of the last menstrual period. Very, very important. It's help you to monitor the progress of your labor, your pregnancy duration, right? Yeah, that's one LMP. You've seen the importance of it. So guys, that's all about menses and pregnancy. So I've talked about LMP. I've told you the importance as far as your progress, as far as the monitoring the progress of your pregnancy is concerned. It's very, very important, right? So that's our video for today. I hope you learned something from today's episode. We'll continue doing more episode. I hope you'll continue learning with us. Share your views in the comment section, and if you're new here or if you have not subscribed, please just click on the subscription button, right? Like and comment. Hope I'll see you in the next video. Hashtag still remains safe motherhood, a positive outcome of a live mother and a live infant, right? So hope to be seeing you in the next video. Yes, thank you for today.